Namaste, everyone. Warm greetings to all of you. Welcome you back again to this episode of Life Scan with Madhav. Welcome to you again, Dr. Hareesh.
Thank you, Madhav.
Hareesh, another interesting thing is about the narco-analysis, or what we call truth serum. How is it generally carried out? Finally, forensic medicine, or for that matter, medical practice, is all about discovering the truth or the true evidence. So, how will we go about this narco-analysis?
Yeah, Madhav. Narco analysis is a type of lie detection test. So one of the type of lie detection tests that are done in India. Usually they take, it is done in the forensic science laboratory.
Okay.
And in Karnataka, the state FSL has got a facility for doing this one.
Okay.
And they use certain drugs like scopolamine, sodium amytal, certain drugs they use. And this is done only with the permission of the court. So without the permission of the court, the narco analysis cannot be done. So in the procedure, these drugs or the medicines are injected, and person is brought to a stage very close to the stage of unconsciousness, where he cannot invent the falsehood, or he cannot resist for questioning.
So it's a more of a more scientific way of interrogation, is it not?
Yeah, it's
and I guess
more
barbiturates are used here, or are there any drugs are also used in this?
Mainly the barbiturates are used here.
Okay.
And one more thing regarding this one is the whatever the statement that a person makes, that can be used only for the investigating purposes. And as per the Indian law, that cannot act as evidence against the same person.
Okay. So it is investigation and scientific interrogation. It may not serve as a solid evidence in the future.
Evidence, yes.
Okay. And one more area I wanted to know is about this capital punishment. Of course, judicial hanging is, all of us, we know that. And, maybe recent hangings of a few of the terrorists that has given us some information or the idea how the judicial hanging is carried out. But are there any other ways, sort of less violent ones to carry out this judicial capital punishment?
Yeah, as you said, Madhav, in our country, India, the judicial punishment is carried out by hanging. So other countries, some countries, they use the lethal injection, which is a less painful method of executing the capital punishment.
Okay.
And some places they give electrocution. So these are compared to the hanging, are less painful method of execution of the death sentence.
Okay. And you said chemicals are also used, and electrocution is also used.
Yeah, certain lethal injections are injected, medicines are injected, so that painless death is inflicted to while carrying out the death penalty or the capital punishment.
Okay. And now, as we move to the forensic medicine in the dead, that is all about the post-mortem autopsy. So can you help us to understand between this forensic or this post-mortem versus the clinical autopsies which are conducted in the clinical practice? How these two are different, and how rigorous, both the procedures need to be. Please share your experience on this.
Scientifically, mainly there are two types, and one more is there academic autopsy, which medical students do during first year MBBS in the anatomy to gain the knowledge regarding the human body.
What we call anatomical dissection.
Anatomical dissection, or it's also called as the academic autopsy.
Okay.
And coming to the medico-legal autopsy, it's autopsy done in police cases. It's a medico-legal cases, whereas the clinical autopsy is not done in a medico-legal cases.
Okay.
And one more important difference is in medico-legal cases, the consent of the relatives is not required. Since it is requested by the law, only the request from the police is sufficient.
Okay.
Whereas in a clinical autopsy, the consent of the relatives is required. So that's the main difference. And clinical autopsy can be incomplete. If treating doctor is suspecting some illnesses pertaining to a particular organ, only that organ can be examined. Whereas medical legal autopsy cannot be incomplete; it should be a complete autopsy. And mainly, the clinical autopsy is done to determine or to confirm the diagnosis or to look for the changes in that particular disease. Whereas the medical legal autopsy, it has got a different objectives, like to determine cause of death, the manner of death, the time since death. If it is unidentified body, how to identify, and in the skeletonized body, further examination of the bones to help the investigating officer. These are the main differences between clinical autopsy and the medical legal autopsy.
I understand the frequency of clinical autopsy is less compared to the medical legal autopsies, is it not? And secondly, with the advanced investigating methods, may it be imaging or the hematological or microbiological investigations, probably the necessity of a clinical autopsy has decreased. So have you come across or have you carried out any clinical autopsies recently?
Yeah, as you said, it's rare compared to the medical legal autopsy. And most of the time, the relatives also, like the present scenario in India, most of the people, they don't like the body to be dissected. So that's why the clinical autopsy is comparatively less than the medical legal autopsy. And one of the clinical autopsy, what we did in our setup recently, a child of about 13 years, he was because it's a case of dengue. He died. Then the body was subjected for the clinical autopsy. And during the autopsy, we found one the hematological abnormality that could be the cause or that could be precipitated by the dengue. So the clinical autopsy will help in knowing the some conditions which are not diagnosed, or if it is a hereditary, if any other siblings are there, the parents can take precautionary measures to deal with such abnormality in the surviving sibling.
Correct. As you rightly said, to establish, the cause of death, it would be very helpful. Even though modern days the necessity of a clinical autopsy has decreased, but finally, I think it will add to the speed of advancement of science.
Yes.
Is it not?
Yes, definitely.
Extending our discussion on the autopsies as such, is it related to a body donation also? How do you deal with body donation or the clinical autopsy? Do you require a consent in these cases, or?
Yeah, body donation, actually the consent
For
of
the
the
academic
relatives is
purposes?
required. Yeah, sometimes the relatives they donate the body for the to the medical colleges for the academic purpose so that the students can study. To receive the body for donation, the institutions will be having their own format and they follow the certain guidelines from the state guidelines. But the main thing is a consent from the relatives is must for the donation before the hospital receive the body for the donation. So the consent of the relatives is must.
Okay. And I guess one of the major challenges during medical legal autopsy is to find out, whether the cause is homicidal or some kind of self-inflicted injuries are there. So would you please give us some brief idea on this?
Yeah. Sometimes after the going through the wounds, the distribution, we come to the a conclusion based on the type of the injury, based on the distribution of the injury, the pattern of the injury. We can make out whether it's a case of homicide or a suicide or an accidental injury. And such opinion from the forensic experts will definitely help the investigating officer, because the investigating officers are not like a medical persons. So the expert or the forensic expert or the doctor who has done the postmortem examination, his opinion will definitely help the investigating officer in further investigation of the crime.
Okay. So generally, a forensic expert will not miss any foul play, is it not?
Generally, we should not miss.
Okay. But as you understand, there
because
will always be limitations in the science. So I'm very sure even forensic occasionally will have some limitations. I do understand. But most of the scenarios, I guess, we will have near answer at least.
Yeah. The one of the actually the like we can say the villain in forensic medicine is the decomposed body. So
Okay.
once the body starts decomposing, we'll be losing a lot of evidences from the body.
Okay.
So that's one of the major limitations to give the opinion precisely after the postmortem examination.
So sooner the post-mortem is carried out, that is medical legal autopsy is carried out after the death, it is going to yield more solid evidence. Is it right?
Yeah, right. So early the examination, the evidences will be chances of getting evidence will be more. If there is a delay with the onset of the decomposition, the losing of the crucial evidentiary material will be more.
Okay. So even during life also we say sooner the better. Now I understand even after death, sooner is better. Is it not?
Yeah, correct.
And,
Yes.
and secondly, one more information I need to know is whether this postmortem or the medical legal autopsies, is it carried during the nights also, provided we have all adequate facilities? Is it legally okay to carry out these medical legal autopsies at night?
Yeah, exactly, Madhav. Actually, if the center has got adequate facilities to
Mhm.
conduct the postmortem examination, the circular from Minister of Health and Family Welfare, the circular released in the year 2021,
Mhm.
it says that postmortem examination can be conducted after sunset if the center has got adequate facilities. But
Okay.
there are certain exceptions. It's also mentioned the circular, the cases of homicide, the suicide, suspected foul play, rape, and decomposed body should not be subjected for postmortem examination
Okay.
unless there is a law and order situation. So there is only an exception. Otherwise, the postmortem can be conducted even after the sunset.
Okay. And postmortems, can they be conducted in two parts? Say, once you do a provisional examination, then it is an extensive one. Can you do it the next day?
In India, actually, it is not. It can be done. The initial examination,
Mhm.
we look for the changes. That is, postmortem changes. The
Okay.
initial external examination. If there is no facility, adequate facility to do the internal examination, the
Mhm.
examination can be postponed to the next day. And again, it's the decision will be taken by the autopsy surgeon whether he can whether to proceed with the internal examination on the same day or to postpone to the next
Mhm.
day. But it's always better if they are postponing the postmortem examination to the next day to have an initial examination, there is an external examination to look
Okay.
for the stage of postmortem changes, because that will help in determination of the time elapsed after the death.
Are there any differences you manage the bodies of, uh, known persons or unidentified individuals? Are there any guidelines or the procedures, special considerations you need to follow in these cases?
In unidentified body, in addition to the other objectives of medical legal autopsy, like determination of the cause of death, time since death, establishment of the identity is very important in the unidentified body.
Okay.
Uh, there are if it is a completely unidentified body,
Mhm.
so it can be buried in a safe, known place, so that in future, if there is any of the relatives, if they come with a complaint of missing person, there are
Okay.
some tests like a superimposition technique using the skull. The body can be exhumed and bone can be used for the superimposition technique.
Okay.
Or recently, some of the centers they started doing the DNA profiling or the DNA fingerprinting of the unidentified body.
Okay.
So in such cases, in the later course also, if there is a missing complaint, so
Mhm.
the DNA of the relatives can be matched with the unidentified body. So
Okay.
this is a more, I feel, effective method of establishment of the identity of unidentified body.
So decomposed body itself is a challenge. Added to that, if the whole soft tissue has been lost, as in case of a skeletonized body, how this challenge you forensic experts address? Is it more difficult to establish
Yeah.
an identity in case of skeletonized bodies, or is there any way out?
Yeah, we, the forensic expert, do get bones or the skeletonized body for the examination.
Okay.
So, as experts, we do the complete examination of the bones. Based on our anatomical knowledge, we find out different entities like what could be the probable age of the individual, what could be the probable sex of the individual, the what could be the probable cause of death. So, and if there is any specific question from the investigating officer, we answer that one or we give the opinion regarding the particular questions.
So
But
by
the
skeletonized
establishment of
body, I understand the entire skeleton or the parts of the bones of the dead individual is available, isn't it?
yeah, yes,
And no soft tissue components are there.
yeah, no soft tissues or sometimes the minimal soft tissues,
Okay.
no organs which help in the determination of the sex, like a completely skeletonized without any internal organs.
Okay.
And again, the accuracy also differs
Okay.
in determination of the sex. If more the number or complete the skeleton, the accuracy will be more with respect to the sex determination and the age estimation.
Is it possible to get the DNA samples in case of skeletonized body?
Yeah, definitely. The DNA samples, it said that the tooth
Okay.
is the tooth pulp,
Uh-huh.
especially for from the molar tooth. It's a good sample for the DNA testing, and
Okay.
also the bone marrow, either for preferably from the long bones that can be collected and can be subjected for the DNA analysis.
And now, as we say, even in the context of clinical consent, many a time we take videos or the audio recordings. So similarly, do you record medical legal autopsies nowadays, or the even the images are sufficient? And how do you deal these kind of scenarios?
We take the images of almost all the cases. It's always better to have a documentary evidence
Okay.
when our this one is questions. So
Uh-huh.
if we have any documentary evidence in the form of pictures, it's photos or videos, it's always better. But the videographing is not routinely done. So
Okay.
whenever there is a request from the investigating officer,
Mhm.
or if the autopsy surgeon thinks that videographing is required, so the videographing of the entire procedure is done. But there are certain mandatory, certain cases it is mandatory, like
Okay.
custodial deaths, the dowry deaths. So
Okay.
in such cases, it is a mandatory. So otherwise, whenever there is a request from the investigating officer, the videographing of the entire procedure is done. But can the photograph is also sufficient in some cases. The photograph with the labels
Hmm.
is a can also be used as a documentary evidence.
Okay. And probably one more responsibility of you experts is to relate the type of wound with the either the weapons or the ballistic weapons which are used, the traditional or the ballistic weapons which are used. So that is one more responsibility, I guess, to relate the weapon and its impact on the body. So how do you go about it here?
Yeah, this is one of the important step in the investigation of any crime. So, especially in the assault cases, we do get weapons from the police. So, the weapons are sent to the forensic expert or the doctor who has issued the wound certificate. We examine the weapon and we check whether the wound sustained by the victim can be caused by that particular weapon or not. So it definitely helped the investigating officer in further investigation of the crime, the weapon examination, and the certain weapons like guns, the firearms, are sent to the forensic science laboratory, the ballistic divisions, for further examination.
Okay. And in the court of law, whatever you establish, the medical evidence, how is it weighed against the eyewitness, Harish?
Yeah, the medical evidences compared to the eyewitness, as per Indian law, the eyewitness has got its direct evidence has got a more uh, evidentiary value or the weightage,
Okay.
and medical evidences, they are the scientific evidences. In the absence of eyewitnesses, the medical evidences play a very important or the crucial role in either establishing the guilt of the accused or
Mhm.
in establishing the innocence of the arrested persons.
Okay. So, extending our discussion on postmortem, Can you recollect for us one scenario where absolutely probably no foul play was suspected at that point of time, and you forensic experts rose that possibility? Is there any example you can recollect?
Yeah, there was a case. Actually, it's done in our department here only. So in that particular case, the history given by the uh, people, not and the police, was he sustained head injury because of fall.
Okay.
So it's not from fall from height. He was standing and he fell down on the floor. And during the postmortem examination, we found the multiple fractures of a skull. That's a head bone.
Okay.
And such fractures cannot occur, usually cannot occur when the person falls while standing. So that too on a surface which is not hard. So when we interacted with the police, they said the crime scenes, the surface was not a hard surface. Then we requested the investigating officer to investigate this case on the line of homicide, that's a murder. And later they did the investigation, and during the evidences, our staff deposed the evidence, and the accused was convicted in that particular case. Because this initially it was as an unnatural death and not a murder like 302. It was booked under a fall. So the examination, that's a postmortem examination, it helped the police investigating officer in trying the investigation of that particular case.
Okay. And Harish, we know that this is a techno-driven world. We know virtual classes, virtual universities, virtual hospitals. So do you guys have virtual autopsies also?
Yeah, we are also not behind others. So in forensic also the virtual thing has been started. So we call it as a autopsy or virtual autopsy. And we take the help of the technology, like radiologists, they use a CT scan, MRI. We also we take the help of the CT scan, MRI to study the internal injuries. So external injuries done like routine external examination of a conventional autopsy. So internal, with the help of a CT scan, MRI, the injuries or the changes in the body are studied. Some centers have started doing the virtual autopsy, but it's not it's not started in all the centers. Could be because of the practical difficulties
I understand.
involved.
But I'm very sure it's going to be of immense use once we do them routinely, particularly the CT. It takes very less time, and the simple causes like bleeding and all, internal bleeding and all, can be easily detected. I'm very sure it will add value to the traditional autopsies.
Yeah. In some cases, definitely it will be useful. And one more thing, the quick and the dissection of the body. And some of the relatives, they may not like the body which is sutured. So suture over the head, suture over the body. And if technology is used, the body will be neat to see. There are some advantages of this use of technologies also. There's a virtual autopsy.
Yeah, in your profession, Harish, you destruct the dead body to create the evidence constructively. So similarly, I have heard from your friends that you have a lot of creative mind, and you got some good artworks. Would you please show them for us?
Yeah, usually means mainly during our MBBS time, undergraduate, this one we used to do the stage decoration for the program. It was not now. So now flex banners are there, the ready-made banners we get. But that time, we only used to do the decoration, other things. But actually, I continued with the sketches.
Okay. Now I'm able to see, Harish.
Okay, this some of the sketches.
Okay.
So whenever I get a free time,
I know.
I do. These were done a little long back only, not recently.
Okay.
The line diagram.
Okay. Great.
And this.
So now you don't get much time or chance to during Ganesha festivals, is it?
Yeah, here it's not like our undergraduate days. During in the hostels, we used to keep the Ganeshas.
Okay.
Now there's no such opportunity, and as a staff or the faculty, it's
You
not
got more
possible to.
responsibilities than
Yeah,
than
as
to
like.
do justice to
And,
your artistic inclinations.
but whenever I get a free time, usually I do some sketches.
Okay, that's great. Thank you again, Dr. Hareesh, for spending time with all of us and letting know how the forensic experts work, and also letting us know that we have a forensic expert as well as artist in you. Thank you so much.
Yeah, thank you, Madhav. Thank you very much.
Thank you, Hareesh.